Welcome to your Pediatric Nclex Master Challenge, where every question pushes your critical thinking to the edge. This isn't just another practice test, it's a deep dive into the complex, high-stakes world of pediatric nursing. Here, every answer counts, every choice matters, and every scenario reflects the kind of split-second decision-making that saves young lives. You'll face everything from congenital heart defects and neurological crises, to endocrine emergencies and ethical dilemmas, each crafted to test not just what you know, but how you think under pressure. So take a deep breath, trust your training, and get ready to prove that you can think and act like a true pediatric nurse. Let's begin. Question 1. A 2-month-old infant is admitted with projectile vomiting after feeding and visible peristaltic waves across the abdomen. Which finding is most consistent with this diagnosis? A. Hypoglycemia. B. Metabolic alkalosis. C. Hyperkalemia. D. Metabolic acidosis. Correct answer, B. Metabolic alkalosis. Rationale. Pyloric stenosis causes persistent vomiting, leading to a loss of hydrochloric acid from the stomach. This results in hypochloremic, hypokalemic metabolic alkalosis. Strategy. Look for clues like projectile vomiting, dehydration, and visible peristalsis. These point to pyloric stenosis and the acid-base imbalance of alkalosis. Loss of acid equals alkalosis. Question 2. A 4-year-old child with a history of rheumatic fever develops shortness of breath and fatigue. Which cardiac complication should the nurse suspect? A. Aortic stenosis. B. Mitral valve regurgitation. C. Pulmonary stenosis. D. Tricuspid atresia. Correct answer, B. Mitral valve regurgitation. Rationale. Rheumatic fever can cause scarring of the mitral valve, leading to regurgitation and congestive symptoms such as dyspnea and fatigue. Strategy. When you see rheumatic fever, think mitral valve damage first, it's the most common cardiac sequel. Question 3. A nurse is caring for an infant with congenital hypothyroidism. Which finding should the nurse expect? A. Hyperactivity and weight loss. B. Constipation and hypotonia. C. Tachycardia and diarrhea. D. Insomnia and sweating. Correct answer, B. Constipation and hypotonia. Rationale. Congenital hypothyroidism slows metabolism, leading to lethargy, constipation, poor feeding, and low muscle tone. Early detection is crucial to prevent intellectual disability. Strategy. Remember, everything slows down in hypothyroidism: slow heart, slow bowels, slow growth. Question 4. A 7-year-old with cystic fibrosis is admitted with thick pulmonary secretions. Which nursing intervention is most important? A. Encourage a low-protein diet. B. Administer pancreatic enzymes after meals. C. Perform chest physiotherapy before meals. D. Restrict salt intake. Correct answer, C. Perform chest physiotherapy before meals. Rationale. Chest physiotherapy loosens mucus for easier expectoration. Performing it before meals prevents vomiting. Strategy. For cystic fibrosis, think clear the airways first. Airway clearance is always priority over digestion or comfort. Question 5. An infant with suspected meningitis undergoes a lumbar puncture. The cerebrospinal fluid, CSF, shows increased protein, low glucose, and cloudy appearance. What does this indicate? A. Viral meningitis. B. Bacterial meningitis. C. Fungal meningitis. D. Tubercular meningitis. Correct answer, B. Bacterial meningitis. Rationale. Bacterial infection increases protein from WBCs, decreases glucose, bacteria consume it, and produces turbid fluid. Strategy. Cloudy plus low glucose equals bacterial. Clear plus normal glucose equals viral. Question 6. A child with Kawasaki disease is prescribed aspirin therapy. Which finding should the nurse report immediately? A. Peeling of skin on hands and feet. B. Persistent fever. C. Dark stools. D. Red eyes without discharge. Correct answer, C. Dark stools. Rationale. Dark stools suggest GI bleeding, a serious side effect of aspirin. Immediate provider notification is required. Strategy. Aspirin equals watch for bleeding and rise syndrome. Always assess for black or tarry stools. Question 7. A 6-year-old child is diagnosed with nephrotic syndrome. Which nursing intervention is the priority? A. Encourage high-protein meals. B. Monitor daily weight and abdominal girth. C. Restrict fluid to 500 milliliters per day. D. Encourage outdoor play. Correct answer, B. Monitor daily weight and abdominal girth. Rationale. Edema and fluid retention are key in nephrotic syndrome. Daily weight and abdominal girth track response to therapy. Strategy. In any question about fluid overload, daily weight equals best indicator of fluid change. Question 8. A 3-year-old with epiglottitis is drooling and sitting upright, leaning forward. What should the nurse do first? A. Examine the throat. B. Prepare for intubation. C. Start 4 antibiotics. D. Obtain throat culture. Correct answer, B. Prepare for intubation. Rationale. Epiglottitis causes airway obstruction. Do not examine the throat, it can trigger total occlusion. Emergency airway management is priority. Strategy. Epiglottitis equals don't look, don't swab, just prepare for airway. Question 9. A 10-year-old child with type 1 diabetes is sweating, shaky, and pale. Which intervention is most appropriate? A. Give 8 ounces of milk. B. Give 1 mg glucagon IM. C. Administer 10 units regular insulin. D. Encourage exercise. Correct answer, A. Give 8 ounces of milk. Rationale. Symptoms indicate hypoglycemia. Fast-acting carbohydrates, milk, juice, glucose tablets, are used if the child is conscious. Strategy. For hypoglycemia, awake equals oral glucose, unresponsive equals glucagon. Question 10. A nurse provides care for a child with sickle cell anemia. Which finding requires immediate intervention? A. Hemoglobin 8G/DL. B. Pain score 7 out of 10. C. Respiratory rate 30 and new crackles. D. Temperature 99.9 degrees Fahrenheit 37.7 degrees Celsius. Correct answer, C. Respiratory rate 30 and new crackles. Rationale. This may indicate acute chest syndrome, a life-threatening complication of sickle cell disease caused by infection or trapped sickled cells in the lungs. Strategy. In sickle cell questions, always prioritize breathing problems or chest pain, they signal potential fatal crisis. Question 11. An infant with tetralogy of Fallot suddenly becomes cyanotic and dyspneic during crying, a TET spell. What is the nurse's priority action? A. Administer oxygen immediately. B. Place the infant in a knee-chest position. C. Give morphine sulfate as prescribed. D. Call the rapid response team. Correct answer, B. Place the infant in a knee-chest position. Rationale. The knee-chest position decreases venous return from the legs and increases systemic vascular resistance, improving pulmonary blood flow and oxygenation. Strategy. For any cyanotic spell in a child with tetralogy of Fallot, knee-chest first, oxygen second. Question 12. A 4-year-old hospitalized for bacterial meningitis becomes increasingly difficult to arouse. What should the nurse do first? A. Reassess in 10 minutes. B. Increase 4 fluids. C. Notify the healthcare provider immediately. D. Administer acetaminophen for comfort. Correct answer, C. Notify the healthcare provider immediately. Rationale. A decreased level of consciousness can indicate increased intracranial pressure, ICP, requiring urgent medical intervention. Strategy. Change in LOC is the earliest and most critical sign of increased ICP. Always act immediately. Question 13. A nurse teaches a 10-year-old how to use a metered dose inhaler, MDI, for asthma. Which action by the child shows correct technique? A. Exhales immediately after inhaling. B. Holds breath for 10 seconds after inhalation. C. Shakes inhaler after use, not before. D. Waits 30 seconds before second puff. Correct answer, B. Holds breath for 10 seconds after inhalation. Rationale. Holding the breath allows medication to reach deeper into the lungs, improving absorption. Strategy. Think, shake, exhale, inhale, hold for 10 seconds, wait 1 minute before second puff. Question 14. Which finding is an early sign of increased intracranial pressure, ICP, in an infant? A. Sunken fontanelle. B. Shrill, high-pitched cry. C. Hypotension. D. Decreased pulse pressure. Correct answer, B. Shrill, high-pitched cry. Rationale. A high-pitched, inconsolable cry and bulging fontanelle are early warning signs of increased ICP in infants. Strategy. Shrill cry equals shocking pressure. Always investigate sudden changes in tone or behavior. Question 15. The nurse suspects epiglottitis in a 3-year-old who has drooling, difficulty swallowing, and respiratory distress. What is the most appropriate nursing action? A. Prepare for intubation and keep airway equipment nearby. B. Examine the throat using a tongue depressor. C. Administer humidified mist therapy immediately. D. Obtain a sputum specimen for culture. Correct answer, A. Prepare for intubation and keep airway equipment nearby. Rationale. Epiglottitis causes severe swelling of the airway. Throat inspection may trigger complete obstruction. Airway readiness is priority. Strategy. In epiglottitis, don't examine, secure the airway. Question 16. A 5-year-old child with a ventricular septal defect, VSD, develops signs of pulmonary congestion. Which medication does the nurse anticipate? A. Digoxin. B. Furosemide. C. Propranolol. D. Captopril. Correct answer, B. Furosemide. Rationale. A VSD increases pulmonary blood flow, leading to fluid overload. A loop diuretic like furosemide helps reduce pulmonary congestion. Strategy. For left-to-right shunts, ASD, VSD, PDA, think fluid overload equals diuretics first. Question 17. A 9-year-old with head trauma has clear fluid draining from the nose. What is the first nursing action? A. Test the fluid for glucose. B. Apply nasal packing. C. Suction the nares gently. D. Elevate the head of the bed to 45 degrees. Correct answer, A. Test the fluid for glucose. Rationale. Presence of glucose indicates cerebrospinal fluid leakage, suggesting a basal skull fracture, a medical emergency. Strategy. Never suction or pack, always assess first, confirm CSF, then report. Question 18. A nurse teaches parents of a 3-year-old who had a febrile seizure. Which parent statement indicates a need for further teaching? A. We'll call 911 if the seizure lasts more than 5 minutes. B. We'll put something in his mouth to prevent him from biting his tongue. C. We'll keep him on his side afterward. D. We'll check his temperature after the seizure ends. Correct answer, B. We'll put something in his mouth to prevent him from biting his tongue. Rationale. Objects in the mouth can obstruct the airway or cause injury during seizures. Nothing should be inserted. Strategy. Seizure rule, protect, don't restrain, and never insert anything in the mouth. Question 19. A 2-year-old with laryngotracheobronchitis, croup, is restless and has inspiratory stridor. What is the priority nursing action? A. Start 4 fluids. B. Prepare for possible intubation. C. Provide humidified oxygen. D. Administer dexamethasone 4. Correct answer, C. Provide humidified oxygen. Rationale. Humidified oxygen decreases airway swelling and soothes inflamed mucosa. Intubation is reserved for severe respiratory failure. Strategy. In croup, calm, humid, oxygen. Agitation can worsen airway obstruction. Question 20. A child recovering from ventriculoperitoneal, VP, shunt placement suddenly begins to vomit. What is the nurse's priority action? A. Record and continue to monitor. B. Place the child flat. C. Notify the neurosurgeon immediately. D. Offer clear fluids. Correct answer, C. Notify the neurosurgeon immediately. Rationale. Vomiting after VP shunt placement can indicate increased intracranial pressure due to shunt malfunction or blockage. Strategy. After any neurosurgical procedure, vomiting equals ICP until proven otherwise. Question 21. A child with sickle cell anemia presents with severe leg and abdominal pain during a vaso-occlusive crisis. What should the nurse do first? A. Apply cold compresses. B. Restrict fluids. C. Administer prescribed 4 opioids. D. Provide iron supplements. Correct answer, C. Administer prescribed 4 opioids. Rationale. Pain in vaso-occlusive crisis is caused by ischemia from blocked sickled cells. Pain management and hydration are the top priorities. Strategy. Sickle crisis priorities, hydrate and medicate. Never use cold, it worsens vasoconstriction. Question 22. Which type of isolation is most appropriate for a child with pertussis, whooping cough? A. Airborne. B. Droplet. C. Contact. D. Protective. Correct answer, B. Droplet. Rationale. Pertussis is transmitted through large respiratory droplets. Droplet precautions include mask, gown, and gloves. Strategy. Whooping cough equals whoops of droplets. Think droplet for respiratory spread within 3 feet. Question 23. A 6-year-old undergoing chemotherapy for leukemia develops painful mouth ulcers. What is the best nursing intervention? A. Use lemon glycerin swabs. B. Provide soft, bland diet with saline mouth rinses. C. Use hydrogen peroxide rinse. D. Give salty snacks to cleanse the mouth. Correct answer, B. Provide soft, bland diet with saline mouth rinses. Rationale. Chemotherapy causes mucositis. Saline rinses are gentle, acidic or alcohol-based solutions worsen irritation. Strategy. Mouth ulcers equals gentle care, no alcohol, no lemon, no peroxide. Question 24. A child's CBC shows, WBC1 200/mm superscript 3, platelets 200,000/mm superscript 3, hemoglobin 11G/DL. What is the priority nursing action? A. Implement strict neutropenic precautions. B. Encourage iron-rich diet. C. Restrict physical activity. D. Prepare for transfusion. Correct answer, A. Implement strict neutropenic precautions. Rationale. A WBC below 1/500/mm superscript 3 equals neutropenia, high infection risk. Protective isolation is required. Strategy. In any oncology or immune-suppressed child, WBC less than 1,500 equals protect immediately. Question 25. A child with hemophilia A injures the knee while playing. What is the nurse's first action? A. Apply warm compress. B. Administer DAP. C. Apply ice and immobilize. D. Elevate only. Correct answer, C. Apply ice and immobilize. Rationale. Bleeding into joints, hemarthrosis, is treated with rice, rest, ice, compression, elevation. Heat increases bleeding. Strategy. For hemophilia, no heat, no aspirin, no IM injections. Ice is safest. Question 26. A 3-year-old with mumps complains of ear pain. Which complication should the nurse suspect? A. Otitis media. B. Orchitis. C. Encephalitis. D. Meningitis. Correct answer, A. Otitis media. Rationale. The mumps virus can inflame the parotid gland and extend to the middle ear, causing otitis media. Strategy. Ear pain plus mumps equals parotid swelling extends to ear canal. Question 27. A child with scarlet fever has a strawberry tongue and fine red rash. What organism causes this? A. Group A beta hemolytic streptococcus. B. Staphylococcus aureus. C. Mycoplasma pneumoniae. D. Neisseria meningitidis. Correct answer, A. Group A beta hemolytic streptococcus. Rationale. Scarlet fever is caused by Streptococcus pyogenes, producing erythrogenic toxin red rash and strawberry tongue. Strategy. Think, strep throat plus red rash equals scarlet fever. Question 28. A nurse suspects dehydration in a 4-year-old. Which finding is most reliable? A. Dry mouth. B. Weight loss. C. No tears when crying. D. Tachycardia. Correct answer, B. Weight loss. Rationale. Weight loss accurately reflects fluid deficit. Other signs are subjective. Strategy. Always use daily weight as your gold standard for hydration in peds. Question 29. A nurse gives an IM injection to a child with thrombocytopenia. What should the nurse do next? A. Massage site for 1 minute. B. Apply firm pressure for 10 minutes. C. Apply ice for comfort. D. Elevate the limb. Correct answer, B. Apply firm pressure for 10 minutes. Rationale. Thrombocytopenia equals bleeding risk. Apply firm pressure to prevent hematoma. Never massage. Strategy. Think platelets low equals pressure high, 10 minutes. Question 30. A child on chemotherapy has ANC 300/mm superscript 3. Which meal is most appropriate? A. Fresh fruit salad. B. Yogurt and granola. C. Cooked vegetables and packaged juice. D. Peanut butter sandwich. Correct answer, C. Cooked vegetables and packaged juice. Rationale. Fresh foods can harbor bacteria. Neutropenic diets require only cooked or pasteurized foods. Strategy. Cook it, peel it, or leave it. Never serve raw to neutropenic kids. Question 31. A 2-month-old with pyloric stenosis has persistent vomiting. Which acid-base imbalance occurs? A. Metabolic acidosis. B. Metabolic alkalosis. C. Respiratory acidosis. D. Respiratory alkalosis. Correct answer, B. Metabolic alkalosis. Rationale. Vomiting causes loss of HCl hypochloremic metabolic alkalosis. Strategy. Vomiting equals alkalosis, diarrhea equals acidosis. Question 32. A child with nephrotic syndrome is prescribed prednisone. Which finding needs monitoring? A. Weight loss. B. Hyperglycemia. C. Hypotension. D. Increased urine output. Correct answer, B. Hyperglycemia. Rationale. Prednisone, a corticosteroid, increases blood glucose. Monitor for hyperglycemia and infection. Strategy. Steroids equals sugar up, swelling down, immunity down. Question 33. A child with acute glomerulonephritis has dietary restrictions. Which nutrient is limited? A. Sodium. B. Protein. C. Potassium. D. Calcium. Correct answer, A. Sodium. Rationale. Sodium restriction prevents fluid overload and hypertension. Strategy. Glomerulonephritis equals salt and water out. Question 34. A child with Hirschsprung disease will exhibit which stool characteristic? A. Projectile vomiting. B. Ribbon-like stools. C. Bloody diarrhea. D. Fatty stools. Correct answer, B. Ribbon-like stools. Rationale. Lack of ganglion cells causes obstruction narrow, ribbon-like stools. Strategy. Hirschsprung equals no nerve, no movement, narrow stool. Question 35. Which pediatric client should the nurse assess first? A. Celiac disease with mild pain. B. Intussusception with current jelly stool. C. GERD with regurgitation. D. Constipated post-op child. Correct answer, B. Intussusception with current jelly stool. Rationale. Current jelly stool equals bowel obstruction, possible necrosis or perforation. Strategy. GI triage, bloody or jelly stool equals surgical emergency. Question 36. A 6-year-old with diabetes insipidus receives desmopressin, DAP. Which finding shows effectiveness? A. Decreased urine output. B. Increased thirst. C. Weight loss. D. Elevated sodium. Correct answer, A. Decreased urine output. Rationale. DAP reduces urine output by increasing water reabsorption. Strategy. In DI, think dry inside. Effective treatment equals less urine, stable sodium. Question 37. A newborn with ambiguous genitalia is being evaluated. Which test comes first? A. Abdominal ultrasound. B. Chromosomal analysis. C. Serum hormone levels. D. Pelvic MRI. Correct answer, B. Chromosomal analysis. Rationale. Determines genetic sex, XX or XY, the basis for diagnosis and management. Strategy. Ambiguous genitalia? Confirm chromosomes before anatomy. Question 38. Parents of a 7-year-old on levothyroxine say, "We give it at bedtime so she can sleep better." The nurse should respond. A. That's perfect timing. B. It should be given in the morning before food. C. You can give it with milk. D. Split the dose morning and night. Correct answer, B. It should be given in the morning before food. Rationale. Levothyroxine is best absorbed on an empty stomach in the morning. Strategy. Thyroid meds, morning plus empty stomach equals maximum absorption. Question 39. A 13-year-old with type 1 diabetes has vomiting, fruity breath, and deep respirations. What's the priority? A. Check blood glucose. B. Administer 4 insulin. C. Give fluids orally. D. Notify provider. Correct answer, A. Check blood glucose. Rationale. First, confirm hyperglycemia to determine severity of diabetic ketoacidosis, DKA. Strategy. Suspect DKA? Always assess, then act. Blood glucose first. Question 40. A 4-year-old with chronic renal failure has K 6.2 milliequivalent/L. Which medication should the nurse prepare? A. Furosemide. B. Calcium gluconate. C. Sodium bicarbonate. D. Kayexalate. Correct answer, D. Kayexalate. Rationale. Kayexalate binds potassium in the intestines for excretion, used for hyperkalemia. Strategy. Kayexalate removes K, potassium. Question 41. A burned child, 40% TBSA, becomes restless, pale, and tachycardic. What should the nurse suspect? A. Pain. B. Hypoxia. C. Hypovolemia. D. Infection. Correct answer, C. Hypovolemia. Rationale. Early burn shock is caused by massive fluid loss from capillary leakage, decreased perfusion. Strategy. Burns equals think fluid loss first, infection later. Question 42. Which child should be seen first? A. Asthmatic using accessory muscles. B. Otitis media with ear pain. C. Mild diarrhea. D. Eczema and itching. Correct answer, A. Asthmatic using accessory muscles. Rationale. Use of accessory muscles equals respiratory distress, immediate priority. Strategy. Always prioritize airway effort and oxygenation. Question 43. A 3-year-old with a tracheostomy is found apneic. What's the first action? A. Call code. B. Remove inner cannula and suction. C. Attempt ventilation through tracheostoma. D. Begin compressions. Correct answer, C. Attempt ventilation through tracheostoma. Rationale. Ensure airway patency before compressions. Ventilation is priority in pediatrics. Strategy. Pediatric arrest equals airway first, CPR second. Question 44. Parents refuse chemotherapy for their child with leukemia. What is the nurse's best action? A. Report to Child Protective Services. B. Notify provider and ethics committee. C. Respect the 7IR decision fully. D. Convince them to reconsider. Correct answer, B. Notify provider and ethics committee. Rationale. Refusal of life-saving treatment requires ethical and legal review, not personal persuasion. Strategy. When conflict of treatment arises, refer, don't argue. Question 45. A 15-year-old undergoing chemotherapy says, I want to die. What is the best response? A. Don't say that. B. Tell me what's making you feel that way. C. You'll feel better soon. D. Let's talk to your parents. Correct answer, B. Tell me what's making you feel that way. Rationale. Encourages open discussion and assesses suicide risk empathetically. Strategy. Therapeutic response equals listen, don't lecture. Question 46. A nurse suspects child abuse in a 5-year-old with bruises in various healing stages. What's the priority? A. Document in detail. B. Report suspected abuse. C. Confront parents. D. Ask the child privately. Correct answer, B. Report suspected abuse. Rationale. Mandated reporters must report suspicion immediately, investigation follows. Strategy. Suspect equals report. Never confirm or confront first. Question 47. Parents of a newly diagnosed autistic child ask for advice. What's most important? A. Maintain consistent routines. B. Provide frequent physical contact. C. Use unpredictable changes. D. Limit speech. Correct answer, A. Maintain consistent routines. Rationale. Autistic children thrive on structure, changes cause distress. Strategy. Autism equals predictability plus routine equals calm. Question 48. A 3-year-old with Down syndrome needs oral medication. What's the best method? A. Offer with milk. B. Mix with applesauce. C. Force with syringe. D. Hide in solid food. Correct answer, B. Mix with applesauce. Rationale. Soft foods aid swallowing, forcing increases aspiration risk. Strategy. Always use safe, simple, soft methods for children with hypotonia. Question 49. A newborn with spina bifida awaits surgical closure. What's the priority pre-op assessment? A. Head circumference. B. Muscle tone. C. Bowel sounds. D. Hydration. Correct answer, A. Head circumference. Rationale. Hydrocephalus is a common complication, measuring head size detects early buildup. Strategy. Spina bifida equals watch the brain, hydrocephalus. Question 50. A 2-year-old with lead poisoning has a serum level of 72 G/DL. What treatment is indicated? A. Chelation therapy with EDTA. B. Iron supplement. C. Activated charcoal. D. Blood transfusion. Correct answer, A. Chelation therapy with EDTA. Rationale. Severe lead toxicity requires 4 chelation with calcium disodium EDTA to remove lead. Strategy. Lead greater than 45 G/DL equals chelation, greater than 70 equals hospital plus EDTA. You've just completed one of the toughest pediatric NCLEX drills out there, and if you made it through, you're already thinking like a professional nurse. Remember, pediatric nursing isn't just about memorizing conditions, it's about recognizing patterns, anticipating crises, and protecting the most vulnerable lives. Keep reviewing, keep reasoning, and keep building your clinical intuition. Because when you walk into that NCLEX exam, or into a hospital room, confidence comes not from luck, but from mastery. You've got this. The next child who depends on your care will thank you for every question you practiced today.